I'm going to start this webinar with a brief introduction. We've known for decades that when contaminants and pollutants are generated indoors, their concentrations are generally higher than those found outdoors. This will get worse as buildings become more airtight to save energy unless sufficient ventilation is provided. Accordingly, there's always a trade-off between energy demand and air quality. The science of measuring indoor pollutants that originate from the cooking of foods and the associated risks is not new and has been ongoing since the 1990s. The behaviour of pollutants is often inconsistent, making their measurement a real challenge. There are thousands of them, and it seems like every scientist has their own favourite pollutant. So which are the most important, and more importantly perhaps, why? Indoor pollutants in houses were prioritised by their health impacts in 2011 by the Lawrence Berkeley National Laboratory, and our speaker Ian Walker participated in that work. This figure can be found in both of the references given on the slide and shows a range of pollutants on the x-axis plotted against the disability-adjusted life year health metric, a measure of overall disease burden expressed as the number of years lost due to ill health, disability, or early death. Note that the x-axis is logarithmic. Actually, it's not the x-axis, it's the y-axis is logarithmic. So each horizontal line is worth 10 times more than the line below it. It shows that PM2.5, particles with a maximum diameter of 2.5 micrometers, are predicted to be more dangerous than any other pollutant by an order of magnitude. Therefore, indoor environment engineers should target them for removal above all other pollutants. By doing this, they are also likely to reduce exposures to other harmful pollutants, especially if they have the same source. Cooking is the primary source of PM2.5s in homes. We also know that the emissions from cooking contain carcinogenic elements, such as polyaromatic hydrocarbons that coat the PM2.5, and that cooking has been linked to lung cancers in non-smoking home cooks. This has the potential to be a very serious problem at a population scale, especially in airtight houses, and so poses some key questions. Is the emission of cooking-related pollutants really a problem in houses? How can we mitigate against the exposure to pollutants emitted by cooking in houses? How can we test and evaluate the performance of mitigation devices? What information might we need to set performance thresholds that might inform standards? These are the questions we will be exploring today with our three speakers, Ian Walker, Catherine O'Leary, and Willem de Gids.